Hello. So I am 7 weeks post-op this week from my lefort revision due to the failed Stryker hardware and my custom lefort plates. And I also had bone grafting both from my own chin and then also Vivigen, which is donor allograft material. And I wanted to make this video because at least for us in the north side of the equator right now, we are having a lot of weather changes and a huge drop in temperatures, and subsequently I have had some symptoms that were at first concerning to me that I can now attribute to the weather and just the normal healing patterns of this surgery. So I wanted to share it with you guys so that you could just kind of see how I triaged myself to help differentiate if I was having concerning symptoms or just normal healing symptoms. So I would say on average, my pain is around like a 2 to 3 at any given time. And this past Sunday, my pain within the span of an hour spiked to about a 7, and I didn't understand why. Up to this point, when my pain changes that dramatically, at any point, there was usually a reason, like my dog's tail smacked me in the face, or I did a lot of talking that day, or like smiling really made my incision and my lefort hurt quite a bit for a while. So, but this was entirely unexplained. I had no idea why. And it actually got bad enough. I deviated from my normal ibuprofen regimen. I did take ibuprofen, it didn't help. So I took a tramadol, and that also didn't help. And I slept horribly. And when I woke up the next morning, I was very puffy everywhere. So specifically through my cheeks right here, and then also around my eyes, and then down here into my jaw, like along through here. So it was like a huge change in pain too, and different type of pain. So I would say up to that point, it was more of like a dull aching pain most of the time through here. And then occasionally I get like a sharp, specifically right here on this right side all the time is where this sharp pain is. But that's never changed since these 7 weeks. And so when I started having, like anytime someone uses the word zinging pain, think of nerves. But I was having like shooting and zinging pain that was kind of going through my face and through my lip. And then my upper lip specifically was like vibrating. It almost felt like when you like lose circulation to your hand, and then as it's getting the blood flow back, it's like that tingling feeling. My lip still feels like that actually, but I was having different variations of strength of like that zingy zappy across my lip, across my face. My eye felt like I couldn't open it as much. It felt like smashed. And then my sinus felt full, but there was nothing in my sinuses. I did a neti pot and nothing came out, which didn't kind of like help me realize that it was inflammation. So the reason I wanted to bring this up was, especially with my incision being open in my mouth and with that exposed screw, I was really worried, and I've been pretty hypervigilant for signs of infection. So some of those do cross over. Signs of infection traditionally in an incision or surgical infection are inflammation, increased pain, which I had. And then here's where it deviated a little bit. My swelling, while it was worse on the right, was bilateral or both sides, not unilateral or one side. And then my pain was like deviating or kind of going up and down. And the next day, it was bad that first night, but the next day it actually wasn't so bad. And that was after a horrible night's sleep. So pain with infection generally doesn't improve on its own, at least in my experience as a nurse. The only thing that improves the pain is when you treat the infection, and if not, it just continues to climb or maintain the same. So when my pain was lower the next day, that was reassuring. The other thing is the swelling. It improved when I worked out, and now I say work out, it was a pretty loose term. I did 30 minutes on the elliptical at about 50 to 60% of my normal intensity. That's about what I've been doing recently. Anytime my like stop point is, or my, how would I say it? My plateau, or where I hold or maintain, is when I start feeling a throbbing in my lefort right here, or since my chin graft my teeth, I'll get a throbbing right here. And so those, if I feel that throb in either of those places, I back off just a little bit. And that's kind of the height of the intensity of the workout. So when I worked out, the inflammation improved, which wouldn't be the case with an infection. And then it would be on one side versus both traditionally. And then the other thing was I didn't have any heat or redness or like any sort of nasty smell or drainage coming from inside my incision. So those were all things that I was reassuring myself of as I was kind of running through my list of symptoms, and I did not experience. So I was thinking about how I can treat the lymphatic drainage that I needed, and then also thinking about nutrition and thinking about the weather. Sunday into Monday is when our temperatures dropped between like probably 10 to 20, maybe up to 30 degrees. I can't remember what the week was doing the week before. But then over in the last 3 days, we also got 5 inches of snow. And so the changes in the weather patterns certainly attributed to the pain and the swelling, which I don't recall happening last year with my first lefort, but my surgery was also 3 weeks earlier. And I think the weather got colder later last year. And so as you heal, you aren't quite as sensitive to those temperature fluctuations, which is good. So it kind of spooked me a little bit, but I'm getting better now. So today was the first day since Sunday that I've woke up. Today's Wednesday, and actually felt hopeful or a little bit better. It's been kind of a rough week, but I went to med spa today, and we did a chiropractic adjustment per usual, and then acupuncture and a lymphatic drainage treatment, which the equipment that they have there, it is like a TENS unit that they put on your calves. And then there's these, I don't know what they're called, electrodes, remotes that you use like a jelly with, an ultrasound jelly, and then put 2 of them on each thigh. And they oscillate from hot to cold while that TENS unit goes. And I'll add my before and after photos to the end of this video. But the swelling difference was like markedly improved after that treatment. And so I think between the acupuncture, the adjustment, and the lymphatic drainage, I feel so much better today. I actually haven't had any pain medicine yet today, which is stellar. So I just wanted to run that through your list. If you start to have a sudden onset increased spike in your pain, start asking yourself questions, especially if you're having associated swelling with it. Other reasons than infection for swelling are things that I've mentioned. So weather changes, positioning. So if you slept maybe on one side, I'm still sleeping elevated on my back, by the way, it's brutal. But if your head even lolls to one side, or if you find that you in your sleep roll to one side and you wake up puffy on that side, that could be a reason. If you have puffiness, you can gently touch it or palpate it and see if it's hot or the same temperature as the rest of your skin, so you can kind of compare with both hands at the same time. And then notice too, does it feel hard? Does it feel like soft fluid swelling? My cheeks were actually swollen enough that they were pushing into my braces, which was really uncomfortable, but it was happening on both sides. And today, my very first thought when I woke up was that my cheeks weren't pushing into my braces, so I knew I was a little bit better today than the previous couple of days. So those would be things that I would ask myself if I were in a situation like this, and I did ask myself. It's always good to send your surgeon or your medical team photos if you're unsure, though, because they can help reassure you. But I do know this journey is long, it is arduous, and it is an emotional roller coaster. And anytime you have more information to reassure yourself and kind of go through and try to triage yourself, it just feels more empowering and comforting, and it doesn't feel like a crisis every single time, because Lord knows we have enough crises as it is without us fabricating anxiety-ridden crises that aren't there. So as far as I go, my only other update is my incision is still open. You can still see the screw, and then there's actually pieces of bone, Vivigen, that donor bone, coming out of the incision at this point, which I have sent a photo to my team, and they said, yes, that is what that is. I'm getting enough sensation in my lip now that that bone feels like a splinter on a raw blister. It's decently uncomfortable. But I am seeing Dr. Movahed in St. Louis a week from today, so I'm hopeful I can show it to him, and it could be we just got to let it be. But I'm hopeful we can do something to kind of relieve that pain from, especially when I'm talking. Talking has been really painful the last few days. So that's where I'm at. Otherwise, we're just kind of holding the course. I'm still off work, still restricted lifting to 30 pounds now. So I'm mucking the stalls on my own, which is really great for the horses. I guess I should specify that. Not doing anything where I'm increasing my intracranial pressure, and I'm still chewing on a fork smush diet or a soft chew diet, which I stopped the last few days to try to give everything a break. So I would love to hear if you guys are having any symptom changes with the weather and things that you found help. And then as always, I'm here for you as a resource. So if you have any questions or concerns, please send me a message. I'll talk to you guys later. Bye.